So the difference between a regular primary care clinic and concierge medicine clinic is that in a regular primary clinic, each doctor takes care of about 2,000 patients or so, which means they're very, very busy. So they see about 25 patients a day. So they schedule 4 to 5 patients every hour. Therefore, you can only see the doctor for a few minutes and then you have to leave. Typically, the wait is around 1 hour when you go to the office. Now, in a concierge medicine clinic, because we only take care of a few hundred patients, fraction of 2,000 patients, fraction of that, we are actually able to see each patient for half an hour at a time. So plenty of time to take care of each patient very thoroughly and go over all the things that are of patient's concern before they leave. So that's the huge difference. And the second difference is that each patient will get the physician's cell number for concierge clinic. So my patients, if there's an emergency, they'll call me after hours directly without having to go through the answering service. And believe me, I do answer the phone call. Third difference is when you call a regular primary care clinic, you get usually phone triage, press 1, press 2, press 3. And somebody comes on or you may have to leave a message. Typically in a concierge medicine clinic, there is no such a thing. When you call, you get a live person. In my office, we have 5 staff. So when you call, you'll get one of them. Sometimes if they're all busy, then I will actually answer the phone. So you get a personalized care. Another big difference is that we do a lot of things over the phone. With concierge medicine, if it is very safe to treat the patient over the phone, we will make it convenient for the patient and we will actually do the triage over the phone. We will actually treat over the phone. So for instance, if you're like 2,000 miles away, and if you happen to come down with a little cold, we ask the patients to call our clinic and we will actually call in medications or instructions on what to do. With regular primary care clinic, if you actually call and if you get through, then they'll usually say, well, go to the urgent care, or maybe they'll offer an appointment with a nurse practitioner or a physician's assistant the same day or maybe in the next few days. Typically, you're not able to see your doctor because he or she is very busy seeing the 25 patients all day long. Right? Another difference is that in our clinic, if patients call saying that, hey, I need my medications refilled, we will call that in within the same day, 99% of times. Whereas if you call for medication refill to your regular clinic, it'll probably take a few days before they get that in. So there are a lot of differences in convenience. But the biggest difference is that it's because we take care of a few hundred patients, we are actually able to devote a lot more time to each patient. We also put a lot of emphasis on preventive medicine, and preventive medicine. Therefore, we do a very, very thorough executive physical. Every year, we spend about 2.5 hours doing a physical exam. So you come in for about an hour with one of my staff and get a full set of blood work done, EKG, body fat composition, nutrition screening, circulation check in your legs, a lung capacity check, and so on. And then about a week later, you come back and the results are all ready. And I do a traditional head-to-toe physical exam and then we go over all the results. That takes about 1.5 hours. Also, another difference is some concierge doctors will actually go to the hospital. It is becoming more difficult to take care of your own patients in the hospital because of the insurance reasons. So therefore, I actually make social visits. If my patient ends up in the hospital, then I will actually go to the hospital and visit them as a social visit. I don't actually manage the patient, but I will actually meet with the hospitalist and make a social visit so that I'm privy to what is going on with my patient. And so that when the patient gets out of the hospital and comes and sees me in the clinic, then I would know exactly what has happened in the hospital. And that's kind of the same with all of the concierge doctors. So to sum up, regular primary care clinics, there are a couple thousand patients per physician. Concierge medicine clinic, few hundred patients per physician. Each visit in the primary care clinic is about 10 to 15 minutes, whereas 30 minutes typically for concierge medicine clinic. Concierge medicine clinic will do a lot of treatments over the phone for convenience sake. Regular primary clinics typically do not treat over the phone. Concierge medicine clinic will do an extensive annual executive physical exam. Regular primary care clinics will do a simple annual physical exam. Concierge medicine clinic will always give cell phone number for the physician so you can contact them at any time for emergencies. Regular primary care clinic, you have to call the clinic to get hold of the physician. So these are the main differences between regular primary care clinic and concierge medicine clinic. I hope this was helpful, and I will see you in the next episode. Thank you.